So very good evening to all of you. And thank you so much for joining me again in this learning program. Today we are going to discuss about core muscles. And we all understand that we have kind of muscles all around that area, which helps in creating the stability of the spine, pelvic region, which is very important to maintain the posture. So as a core, it is like a cylinder, and we need to understand the cylinder. And the cylinder has a upper part, anterior part, posterior part, and lateral part, as well as the lower part. So we'll try to understand the whole cylinder as a whole muscles around the area, and this is what we are calling it as a core muscles, more central part of our body. So, and how important is each and every muscle into that area. And very, like another thing is the pelvic floor muscle, which is kind of crucial muscle and which is missed muscle actually. We as a physio has, now we are starting learning about pelvic floor, but in our curriculum, it was not taught in that much detail. So there are less understanding which we are having about the pelvic floor and how it is an integral part of this core. Let's understand today. Not only the pelvic floor, each and every muscle affect the functioning of other muscles. So as a short, we can understand that there are four muscles: abdominal diaphragm, pelvic diaphragm, anterior abdominal, and posterior abdominal with lateral expansion. All this is creating a core, and every part can affect any other three muscles. So one part, like pelvic floor, which is a downward, like the bottom, can affect the upper part. Upper part, which is the abdominal diaphragm, can affect the lower part. Back muscles can affect the all these three muscles. Anterior abdominal muscles can affect all these three muscles. So we are going to understand everything in kind of bit detail today. And this is going to give you some answer about, sometimes we have patients coming in and we are always telling the core workout. But when we are talking about the core workout, so this core is not always related to the strengthening workout. So core muscles should be, we should follow the principle. Whenever we are working as a physio, we should always follow the principle of physiotherapy, which I believe the first principle of physiotherapy is good relaxation. So all the muscles which is present in our body, they should be kind of relaxed. They should have a flexibility. They should not have any tension, tightness, and any hypertonicity. We don't want tight structures. The first principle is body should have a relaxation. Body should have a ability to facilitate the movement. So that is very important aspect of principle of physiotherapy. First is finding the movement. For finding the movement, mobility is important. For mobility, flexibility is important. For flexibility, relaxation of the structures and the muscles are important. So first is relaxation capacity. And the second is that applies to all muscles. And the second is after having the relaxation, if the muscles are good, they are active. All the muscles should have activation. They should be active muscles. And when they are active, so when we talk about the active, so we need a neuromuscular facilitation. So the nerves which supply that particular structure should be also good, optimal. So nerve supply, so we can have a good sensation, good active tone into that muscle can be maintained by the nerve supply. So this activation is the second part, which where that nerves also play an important role in functioning of the muscles as well as the muscle functioning itself. Third is when the muscles are they are active also, the third important aspect is how strong those muscles are. So they should have an optimum level of strength to maintain its efficient functioning to support the body. So this is what I feel we should always follow our three principles: relaxation, activation, and maintaining the contractions. So good contractions means good power. And after power, like after this having good contraction, your muscles is able to contract optimally. The fourth aspects comes is how powerful, how strong. So when we talk about the powerful and strong, another thing comes here is this is what we call it as a endurance ability. How much power they are having, for how much long they can sustain any activities. So the power of the muscle, endurance of the muscles, and how repeatedly the muscles is able to perform any activity. So this is what I always believe, that every muscle should follow the same uh, program, same principles. Okay, so the first we are going to start here. You can keep any muscle in your mind. The principle which we should follow should be this four particular thing. First is relaxation, which facilitate the movement and range of motion of the joint. Second is activation of the muscles. Third is contraction ability of every muscle. And fourth is power. And power, again, endurance and the repetition. So this is the fourth thing which also apply very important into this core area, the central area of our body. So let's understand the core today. We all as a physio are knowing the word core. Nowadays, you might be hearing that Pilates workout, core workout, so this kind abs workout, these kind of things comes into picture. But is it only the abs workout is the core workout? So it is very important to understand everything when we are saying C-O-R-E, core. So the word itself is made up with the four letters C-O-R-E. So same way, it is a central area and we have four regions into this whole core. One is the upper part, which is kind of superior part of the core. One is the inferior part of the core. One is the anterior lateral part of the core, as well as the posterior part of the core. Yes, we have understanding. We know about that. Out of this, one by one, we will try to understand a little bit of this, because again, I will tell you and teach you about the diaphragm. If it is an abdominal diaphragm or pelvic diaphragm, it is separate a kind of very, very huge topic. It can take another 30 to 40 hours. If I tell you about abdominal diaphragm, it can take 15 to 20 hours. If I tell you about, if we will discuss about pelvic floor, it can again take 30 to 40 hours. So same way, so much deep is there into this subject. But today we have a limited time and we are already trained people and we are already working with our patients. But where we are missing, what we are missing into this course, this is what we will try to understand from this today's session. We understood the core is very important and all the muscles are important. I will not say specifically, every muscle is important and pelvic floor should not be missed. We should always keep pelvic floor as a crucial part, as an integrated part of of this core. So, which we will understand today is the complete cylinder which we are having into the area. So when we divide our cavity, so we know that our body has a different cavities. So the first is the you can say cranial cavity where our brain is present. Second is a thoracic cavity where our thoracic organs are present. Then we have an abdominal cavity where our abdominal contents are present. And then we have our pelvic cavity where pelvic contents are present. So these are, when we talk about all these contents, the cavities, so every cavity has this cylinder. So today what we are going to discuss here is about the central part. It means that more central part, not the thoracic. It should be the abdomen, something around the abdomen. Anything which comes into the abdomen, even the very important part is the breathing, which is kind of crucial for our living. So whenever we are inhaling and we are exhaling, how these organs are moving and they are creating a pressure. Not only the breathing, whenever we are loading our body, whenever we are pushing something, pulling something, or we are doing some kind of activities as a physiotherapist, and even as a normal people, our normal functioning day to day, the aging process and some events in our life like pregnancy, childbirth, obesity, how these things are affecting the whole core. This is what we will try to understand today. The first is what we will try to more focus on will be these four muscles. The first will be around the abdominal diaphragm, pelvic floor, abdominal muscles, and the multifidus, the back muscles, and how they are kind of affecting each other as per the our as per our process, as per the body functioning. So the first is, we all know the first uppermost part of the central, this when we talk about the core, is a diaphragm. And the lowermost is the pelvic floor. So just a simple breathing. So how this simple breathing is affecting? So that is the first is inhale. Whenever we are inhaling, the air is going inside and this air is increasing the pressure into the lungs. Lungs are inhaling oxygen and the lungs are moving downwards when the air goes into the chambers. So this lungs is descending and that is going to put pressure over the diaphragm, abdominal diaphragm. The first effect which is there of this breathing pattern is over the abdominal diaphragm. And we know the abdominal diaphragm, we know the anatomy of the abdominal diaphragm, and we also know that's a dome-shaped muscle and how it is going to descend downwards when the air pressure will be high into the thoracic cavity. So this is going to put pressure downward over the dome shape. So now it is very important to understand this dome shape. So yes, we are kind of aware that we have this thoracic diaphragm, and this is kind of parachute which is present, which is all situated around the bottom of the thoracic cavity, and it is a kind of dome shape. So it is concave and convex both way, isn't it? So thoracic diaphragm is situated, at the thoracic cavity, at the bottom of the thoracic cavity, and it is separating the thoracic organs from the abdominal contents. So this is a kind of one layer, one floor between the two cavities. And this floor is again divided in, as our whole body is divided into right and left, the diaphragm is also right and left diaphragm. So right side of diaphragm will come from that, you can understand that the origin is from xiphoid process of sternum, costal margin of the thoracic wall, lower ribs, and lumbar vertebra, and ligaments of the posterior abdominal walls. This is all the origin of this kind of one side of the diaphragm muscle and other side of the diaphragm muscles, and they are going to merge with each other. All the fibers, they are going to merge with each other at the central tendon by creating a central tendon. So there's a kind of meeting point of right and left sides. So, and we also understand that we have a body, the right side of the diaphragm is slightly lower because we have this right side of our, like we have this lungs on the left, on this right side. So our left side is kind of lower and right side is kind of higher. So some kind of higher side is there into right side because of the presence of the lungs. So because lungs needs more space. So this is what simply we understand. We are already knowing about these things about the diaphragm, and we have a cavities present. Like we have a some kind of openings present for inferior vena cava. Then we have opening is there for lungs. Everything is present there into this whole diaphragm, abdominal diaphragm. So yes, we understood that this diaphragm is there, and diaphragm has to work as a up and down, descend and ascending motion. Whenever we are doing any activity, and specifically normally breathing. So down in. So the more normal function of the this thoracic diaphragm is respiration. It helps into respiration. So when these muscles are good enough into the area, they will help in maintaining the thoracic rib cage, their dimension, their kind of expansion. So anterior, posterior expansion, lateral expansion. The good muscles, when they are good toned muscle, good relaxed muscle, they are not tight as well, they are not very loose as well. Good dome-shaped muscle will help to bring the thoracic cavity and thoracic cage in a optimum levels, and the structure will be good. And this is what is very important to assess important factor of our life, of our body, that is a infrasternal angle. So you can see in this image that this whole both side of the lower ribs, they are joining at the xiphoid process, and they are creating one kind of angle inferior to the sternum. And this angle is very, very important angle to understand what is the level of the diaphragm. And this angle somewhere we are missing in our assessment. Okay. So let's talk about this angle. This is what we are calling it as an infrasternal angle. So normally, if we say that what should be the infrasternal angle? So it should be around 90 degree in a normal person. So once this angle is 90 degrees, so you can understand your abdominal, your diaphragm is not hypertoned, or it is not hypotoned. So it is having a kind of good tone. It is good dome shaped muscle. Okay. So not too much of concavity, not too much of convexity. So very important angle which we should always assess in all our patients when they are coming to us. It doesn't matter if your patient is coming for your back pain, pelvic floor pain, and pelvic floor dysfunction, back problem, abdominal issues, we should always start with palpating the infrasternal angle. You can understand why it is important, because from this whole ribs, the dome is going upside. And you can say that normally it should be 90 degree, but if this angle is less than 90, if it is narrow, okay, so you can understand that dome will be more ascending dome, upper side dome. So that is going to put more pressure into the thoracic cavity. So you can understand that if the angle should be 90 degree. If the angle will be more narrow, so this narrowing is going to bring the thoracic cage together. Ribs will come closer to each other. Once the ribs, the lateral aspect of the ribs, when they will come closer to each other, so the dome will be ascending dome, upside dome, and that is going to put pressure more over the thoracic cavity. In this case, when this ISC angle is more narrow, upward ascending pressure, more increased thoracic pressure, so you can understand that is going to give shallow breathing. Person inhalation will not be optimal, and the inhale will be kind of not complete. So it is a kind of a shallow breathing. Person will be doing the short and shallow breathing. So, and that is going to decrease the thoracic expansion, and thoracic cavity, that is going to decrease the kind of pressure into the thoracic cavity. So, and always it is kind of upside pressure will be here into this part. So too much of dome. So do we want too much of dome, too much of tension? And when it is too much of dome, so you can understand ribs will come closer. And when the ribs will come closer, that is also going to affect other abdominal muscles, like all our obliques, which is coming from that, which is kind of originating from external obliques, internal obliques, all the abdominal muscles, because they will be more closer to each other. Okay, so obliques will be more tensed, tight. So because this dome is upside, so more kind of which diameter? It will be the lateral diameter of the thoracic will be narrow. So the moment the lateral diameter of the thoracic will be narrow, patient will, so lateral is narrow and anterior posture will increase. So patient can start showing you barrel chest. And due to this barrel chest, you can understand that there will be shortening of the muscles. So there will be back muscles which will be tight because of this anterior posterior diameter which is increased. So this posterior muscles will be tight, as well as anterior muscles will be also tight. And this is going to create, again, not a good pattern into the body. So very important to understand this infrasternal angle. Just somebody is asking for the name.
Ma'am, please explain this again.
Someone is there in the waiting list?
Yeah. No.
Yeah, please say.
Please explain this again.
Yeah, please say again.
Explain this again.
Sorry?
Explain this again.
Okay, explain this again. All right, okay, definitely.
I'm,
Yes.
I'm Lina here.
Yeah, hi, Lina. How are you?
I'm fine.
Yeah. Okay, let me explain it again. So just a simple, let me explain it through just a demonstration first. Assume we all know the dome shape, okay, like dome like this. So these muscles are attached from this lower ribs. So the ribs are kind of, now this is a sternal process, sternum. So ribs are also attached at the sternum and dome shaped abdominal muscles are also attached there. So now what will happen if these infrasternal angle is narrow, so we should always assess this infrasternal angle. If that is narrow, if you found it is less than 90 degree, so what will happen? This ribs will come closer, isn't it? The lateral aspect of the ribs is going to come closer to each other. Once the ribs will come closer to each other, assume that you are squeezing a balloon from the lateral side. Once we squeeze the balloon from the lateral side, so anterior posterior diameter of the thoracic cage will increase and lateral diameter of the thoracic cage will decrease. And that is going to, again, now what will happen to the dome shaped muscle? The dome shaped muscle will become more upward, more ascending. So once it will be more ascending, so that is going to put more pressure over the thoracic organs. So it means during the inhalation, complete proper inhale will not be possible because muscle is not descending down. It is stuck upside due to this kind of tension and tightness. So it is upward, stuck diaphragm, abdominal diaphragm. So now inhalation will be problem, and that person will be possible present with the kind of difficulty inhalation, and it will be all the time kind of might be a shortness of breath or shallow breathing. So very fast breathing can be present and not a complete relaxed abdominal breathing will not be present into this patient. So very important to always assess this thoracic angle, infrasternal angle. It should not be less than 90 degree. And if it is less than 90 degree, ribs will be squeezed together. They will come closer to each other. So you can understand how it is going to affect the anterior and posterior muscles. Anterior muscles and posterior muscles will be over kind of, when you're squeezing the balloon, okay, from the sides, there will be loading of posterior muscles, weakening of that, even the pectoral muscles also, and tension and tightness of the lateral muscles. So lateral muscles will become tight, both side, and anterior and posterior muscles will become loose. So is it a right kind of structure? The answer is no, this is not right. So the patient will show you barrel chest and will walk like this. So this is absolutely not good. So we should always consider checking this infrasternal angle, important part of assessment. Why? You can also understand when this angle will be narrow, and if this angle is bringing the rib cage together, the muscles which is going from the side from the rib cage, so we have obliques coming, isn't it? So this obliques will be, now what will happen to the obliques? Because it is a kind of this tension. So the oblique will become tight and then obliques will become tight. So it will be more tight abdominal muscles also, not more kind of squeezing effect like this. So rectus abdominis muscle, which is into the center, so that can get the squeezed, isn't it? Squeezing pressure. So that can give you some kind of overstraining, overstretching over the rectus abdominis, squeezing effect. So again, anterior, so what kind of pressure will be building to the abdominal cavity? So when the thoracic cavity is squeezed like this is upside. So again, the same pattern is going to follow into the abdominal cavity also. So the way we show that the lateral expansion was less into the thoracic cage, same thing will happen to that abdominal cavity. So lateral expansion of the abdominal cavity will be narrow. So it means again tight obliques. And when the obliques are tight, so they will pull the rectus abdominis, the central muscles. So they will become loose and weak. So that is very important that this muscle, this tension can create a tension in the whole aspect. every part, thoracic cavity squeezed, abdominal cavity squeezed. The same way, pelvic floor cavity. When you see that we have pelvic floor muscles, so the pelvic floor muscle, now we have pubic symphysis where rectus abdominis muscles are coming and they are attached here. And we have obliques are also going from this ilium side, isn't it? They are going, we have transverses also coming from the sides like this. So you can understand when these muscles are tight, they are going to create a tension into this lateral diameter of the pelvic floor. So the whole area, whole posture or kind of, if you say the every cavity will be more anterior to posterior diameter of every cavity will be more as compared to the lateral. So we don't want lateral high or anterior posterior high. We want everything in a synchronization. But if you are squeezing the balloon from up, it will be squeezed balloon into the abdominal cavity and it will be squeezed into the pelvic cavity also. And you can understand every content is kind of squeezed. Every organ which is present into the thoracic cavity will not work efficiently. Every organ which is present in our abdominal cavity will also not work efficiently. And even in the organs which is present into the pelvic cavity will also not work efficiently. So this anterior posterior diameter will be always high, and that is going to create a weakness in anterior posterior muscles and tightness into the lateral muscles. So this is very, very important aspect which we should always assess in each of our patient infrasternal angle. Okay, I hope it is clear, but let me give you again this clarity with our slides. Okay, now let's see. The angle should be 90 degree, but if it is less than 90, we can call it as a narrow ISA angle. Infrasternal angle is narrow. If it is more than 90, the infrasternal angle will be wide. So can we give any stage in our life where we can have narrow cavity and in which cases we can have a wider cavity? So we can see that any person who is having too much of, who's working all the time into core workout, like too much of Pilates, if person is doing too much of Pilates, so you can understand like doing excess of everything, too much of tight abdominal muscles can also bring that sides muscle uh, together. They can bring that thoracic cage together. In these cases, when the person is doing high abs workout, very tight abdominal muscles, their infrasternal angle can be less, narrow, okay? And their diameter, lateral diameter can be less, anterior posterior diameter can be more. Same way, if we have stages in our life, like if we are overweight, we have obesity. So too much of weight in the body and even into the abdominal area, visceral weight is very high. So you can understand if the visceral weight, what is the visceral weight? Visceral weight means what is the visceral fat? Visceral fat means the fat accumulation around the organs, visceral organs. So that organs can be the thoracic organs. Too much of fat is present in the area, the abdominal content, too much of fat is present inside. So when internal fat is accumulated, that is going to create a pressure, because you can understand into this room, if there will be elephants, that is going to put a pressure over the walls. So the fat can also push the walls on the sides. So that can increase the angle in all the way. So increase diameter. So in this case, these angles can be wider, isn't it? The rib cage can be flare up outside. Another thing is not only the obesity and the central abdominal weight, even the obesity, even that pregnancy, sorry, whenever we are pregnant, during the pregnancy also, when this uterus is growing up, so that uterus requires space, and we all understand that how it is affecting the whole abdominal cavity and whole core. So that is going to even create an expansion into the cavity, abdominal cavity, and the ribs will be also relaxed, because we need to the whole body bone will start getting relaxed because we need to accommodate the baby, growing fetus and growing uterus. For the space which we need, the bones are going to expand. And when the bones will start getting expand, you can understand that in this case, yes, that ribs will start getting flare up outside. And in this case, the infrasternal angle can start getting wider. So is it wide infrasternal angle or is it a narrow infrasternal angle? Every case we should assess it. It is very, very important. And I think we are missing it in our practice. This assessment is not there.
Okay.
Still, let me give you again another thing is here. If the angle is wider than 90 degree, okay, so what will happen? The ribs will go, they will fail to bring the ribs in an optimal position because this angle is wide. So ribs will move away from each other. So they will be kind of flaring of the ribs or flared rib. We can also name it as a flared rib. And once the flare ribs, it means ribs will go away from each other. So the dimension, the which dimension of the thoracic area will be more. So that will be the lateral dimension, lateral. So and which dimension will be kind of narrow? Anterior portion will become narrow. Lateral dimension will become increased. And what will happen to the muscle which is attached with the ribs? It will start descending down. So which muscle is there? Abdominal muscle, abdominal diaphragm. So not abdominal, abdominal diaphragm. So this abdominal diaphragm, because it is attached with the ribs, the moment the ribs will go away from each other, abdominal diaphragm will go downward. So more downward pressure means more pressure of this abdominal of this thoracic area over the abdomen. So it is going to create downward pressure over the abdominal content. So all the abdominal area, all the abdominal organs will be always descending down due to this pressure which is falling on that from the diaphragm. And diaphragm will kind of stuck down instead of moving fully up also. Because during inhale, it is descending down. During exhale, it is ascending up. So in this case, patient will have difficulty in complete exhale because you can understand it's descending downward diaphragm. So again, respiration will be altered here. It is going to affect the respiration of the person. So, and respiration and breathing is the first priority of our life, and that is affecting everything, all the pressures. So, in this case, you can understand when there's a descending downward pressure, descending diaphragm, it is going to put descending pressure. Descending pressure will increase the pressure over the abdominal area, and when the abdominal organs will be compressed down, they will increase the pressure over the pelvic area, pelvic organs, and pelvic organs will also, if someone is pushing me down, I will be always descend down. Means I'm an organ, abdominal organ, I will put downward pressure. Downward descending pressure will be there on me. So I will descend down. And I'm going to put pressure on my lower contents. If from the abdomen, which organs are present? Pelvic organs. So pelvic organs will be always kind of pressurized from the abdominal content. In this case, pelvic organs will not be able to perform their functioning, isn't it? So you can understand we have organs like bladder is there and bladder need expansion. If we have this filling stage going on all the time, we need to fill the urine into the bladder. But in due to this downward pressure, the expansion of the bladder is going to affect. So it will not be fully able to expand up because there is a descending pressure going on. And thoracic, the abdominal pressure is high into the abdominal content. So that can affect the filling stage into the bladder. So once you cannot fill the optimum optimum quantity of urine into a bladder, so the frequency of urination is going to be increased. So in this case, if you ask your patient that if you see that they have a wide infrasternal angle, the one question you can ask a patient, how many times you are going for urination? And normally we all know that normal frequency of urination is approximately 6 to 8 times. But this patient can tell you that they are going 10 to 12 times. So frequency will be high. So again, we can understand, yes, it can be due to this all the time, increased abdominal pressure, increased abdominal pressure over the pelvic organs also. So descending pressure is there, okay? And another thing is not only the urinary frequency can be also increased. Sometimes if you ask your patient that, you can understand it's descending pressure all the time. So this descending pressure is going to affect the tone of your muscles, which is present there. So the tone which is present, like we have a slow twitch muscle fiber in our body, which works all the time to support our organs, and maximum number of slow twitch muscle fibers which is present into the that they are present into the pelvic floor muscles, because they have to work against the gravity all the time, against this weight load from the abdominal organ. So we have a slow twitch muscle fibers present, and these slow twitch muscle fibers are responsible for maintaining the long-term tone. So, but if there's always continuous pressure is falling into the abdomen, and that pressure is falling over the pelvic organs, that pressure can always affect these pelvic floor muscles, and that can affect the tone of the pelvic floor muscles, because muscle is working as a trampoline, as a good tone, but if it's a descending pressure over the muscles, it might start getting weaker. And the muscle which is responsible for creating the tone, for sustaining that continence in our life, because we don't want leakage of urine. So in this case, in the longer term, if your muscles will start getting loading and they will start getting weak, they might not, they might miss their contraction capacity around that urethra, because urethra is present, and around the urethra our pelvic floor muscles are kind of loop around, and they have this tone which always keep contracting the urethra. So but if the muscle will become loose, so the ability to contract the urethra will be now less, and in this case there might be leaking of urine can also come. So the first is you check your person infrasternal angle. If you found this infrasternal angle is wide, ask your patient a question, how many times you are going for urination, and ask another question, do you have leakage during sneezing and coughing? Because sneezing and coughing is again increasing the intra-abdominal pressure. So in that particular time, patient might tell you, yes, I have a urine leakage. So there you go, there you get your patient off pelvic floor dysfunction. Patient is having pelvic floor dysfunction. So weak pelvic floor muscles. But the weak pelvic floor muscles is what we have to treat. The bottom part. But we also have to treat this upper part, because it can be this weak pelvic floor muscle is due to the weaker and descending dome-shaped abdominal muscles. So this is the whole body approach, the whole core approach. Upper part descending down, keep putting pressure down, and the lower part might be weaker. So the both are weak. Even the abdominal diaphragm is weak, and that is putting a downward pressure. That is going to put pressure over the pelvic floor, and pelvic floor can be also weak. So this is very, very important, and this is what is the integrity. One can affect the other. Not only the pelvic floor muscles dysfunction will be present, even patient might also show you that rectus abdominal muscle separation. Now you can see that this descending pressure is going to, this kind of this flare up of the ribs are going to create a flattening of the dome. So when the dome will be flattened, so that is kind of lower pressure, and that will create a stretching of what will happen to the lateral muscles of the abdominal. So the lateral obliques, they will stretch out. When they will stretch out, so if this is stretching outside, so you can understand lateral diameter is increased. When they will stretch out, so who will start getting stretch out here? So rectus abdominis, which is a central muscle, they will start getting flare up. More, they will be more kind of, separation, because it is right and left muscles all the time. So one rib is moving on that side, one rib is moving on that side, both are flared up. The muscles which is attached will also start getting flared up. It means the muscle which is into the center will also start getting flared up, and that can lead to diastasis recti. So means that will cause more loading on the linea alba, and that is the linea alba is the connective tissue which is holding our, where all the muscles are, all the aponeuroses of the muscles are attached. Now you can understand the patient can be present with diastasis recti as well. So this is kind of whole body approach. So the flaring of ribs, descending of the diaphragm, uh, weakness of the abdominal muscle, descending away from, it's like, separating rectus abdominis from each other, separating of the connective tissue from each other, diastasis recti will be present. You can also understand what will happen to that pelvic pubic arch. So we have this pubic bone. Okay, so assume that we have too much of stretching going on. So in this case, you might be, this is like this, okay, more stretch out. So the muscles are attached here. So more stretch out. So what can be present here in this case? In this case, there might be, due to this weakness, there can be ischial tuberosity will be closer to each other. You can understand this like this, flaring up. Okay, more expansion on the lateral side. So when there's more expansion to the lateral side, the anterior posterior diameter will become kind of narrow and lateral diameter will become more out, okay, outward like this. And that can show you the pain around the pubic symphysis here. And you can also see linear alba is attached. All this pyramidalis muscle, which is part of abdominal, even the rectus abdominis is attached here. Now from here, which muscle is coming from the pelvic floor? Pubococcygeal muscle, which is going downward. If you are aware about the pelvic floor muscle anatomy. So pubococcygeal is going on. So that pubococcygeal will become stretch out and this side muscles will become narrow. Superficial transverse perineal will start getting kind of tensed. And this diameter, anterior posterior diameter will be more wider. So when we have widening going on here, recti of our like rectus abdominis is going to get separate. You can also understand this anterior posterior muscle which is present here, and that muscle is specifically this muscle. Can you see the central muscle which is coming from the pubic bone and going all the way to the coccyx? So this muscle will be stretched out because this both side is closer. When they are closer, so which diameter will be increased? Anterior to posterior. When this will be increased, so it will be strained muscle, and that can lead to might be lead to more weakness into the central muscle, which is this muscle, pubococcygeus. So pubococcygeus muscle separation due to the loading, weakness. So we have two muscles. From one side, other side, this pubo to coccyx muscles are going. So one and one. These muscles are attached from pubic to coccyx. So you can understand when they are stretched out, so what will happen to that? They will start getting weak. So this muscle is very important where our organs are resting. So we can understand our organs are resting like this, and the organs are resting into the central muscle. So this muscle will lose its strength, it will become weak, and it will start descending the organs downward, and it can give pelvic organ prolapse. And we can term it as a levator ani separation, we can say, or we can also say it's a pubococcygeal muscle recti. Like we have abdominal recti, diastasis recti. Same way, we can say that there's a pubic recti will also start here. So pubic recti, like something like this will happen, pubic recti. And now here, pubococcygeal recti due to the weakness. So that there are high chances of straining it downward. So this is the whole core is affecting. Upper body is affecting the diaphragm, is affecting the this central abdominal muscles that can affect the pelvic floor muscles. So this way, that can also affect the back. We will understand that in the upcoming session, but let's just go slow. So you can understand how the diameters are going to increase. Normally, in kind of narrow infrasternal angle, anterior posterior diameter will be high, lateral will be narrow. Over here also, even over downward also. Okay, and in case of wide infrasternal angle, so which lateral diameter will increase and anterior posterior diameter will be decrease. So this will be high. So over here also, and over, that is going to affect, that's going to create a kind of weakness of anterior to posterior diameter there. Okay, so squeezing, where you are squeezing, at which level you are squeezing the balloon. If you are squeezing the balloon like this, the angles will be narrow. If you are squeezing the balloon like this, the angle will be like this angle will be, this dimension will be increased. Okay, so very important assessment of infrasternal angle. And I request all of you now keep it an important part of your assessment. There are very less correlated studies, but we are the people who have to come up with the studies. This is what I found in my practice. Whenever I'm treating the pelvic floor, there's always issue going on with the back, and there's always issue going on with the abdominal muscles weakness or tightness, or muscles with the issue going on with the diaphragm, which is affecting their respiration. And we all know that respiration is something which is creating a complete relaxation in our body when we are inhaling. Okay, so complete relaxation happens. So once we cannot inhale properly, complete relaxation cannot be achieved into the body. Okay, and simultaneously, exhalation is also a very important part. So this is that optimal breathing can be suffered due to the kind of very ascending pressure or very tight dome, or descending pressure with flattened dome, abdominal muscles. Again, we have, let me just go through the slide. So this is wide infrasternal angle more than 90 is going to increase the anterior postural compression at the chest. Their rib cage cannot easily expand with air because the rib cage is over compressed. Person will feel difficulty in thoracic breathing. Okay. And you can say that due to descending pressure, always descending pressure, there will be flare up of the ribs, causing descent and flattening of the diaphragm, causing more pressure and stretching of the lateral obliques on the side, causing the weakness of that obliques muscle, and more lengthened oblique muscles, more weaker oblique muscles, which will pull the rectus abdominis on the side and causing the strain over the linea alba and can give rise to the diastasis recti. Please click this screen. Please take a screenshot of this slide. It might help you. And in this case, anterior posterior diameter can be narrow and lateral diameter of the thoracic abdominal can be wider. And patient can be present with the upper cross syndrome and lower cross syndrome. Now you can understand now why it is happening. Because of this descending pressure over the thoracic, there will be more kind of forward poking of that chin. So, and kind of droop shoulder and weak deep neck flexors, tight pectorals, weak lower trapezius, tight upper trapezius, and this is going to cause tight erector spinae, tight iliopsoas, weak abdominal, and weak glutes. And there's a different effect over the pelvic floor muscles also, because muscles of the pelvic floor are going from the anterior to posterior, and they are also coming from the lateral to central. So lateral to central muscles are superficial transverse perineae, deep transverse perineae. These muscles are coming from the sides, and even middle layer of the pelvic floor muscle, they are also coming from the sides. So they will start getting somewhere tight, and the muscles which is coming from the anterior to posterior, like pubococcygeus, bulbocavernosus, external anal sphincterix, they will start getting weaker. So anterior posterior muscles will start getting weak, and lateral muscles of the pelvic floor will start getting tight. And this is what is the effect of the whole core. Okay. And again, how it is going to affect the back, we will discuss in upcoming session. But if this is how we have to palpate, but I'll tell you later on. If the angle is narrow, infrasternal angle is narrow, less than 90 degrees, so lateral compression, so the angle is narrow. So what will happen with the dome? It will be ascending pressure. Okay, ascending pressure means lateral diameter will become narrow and anterior posterior diameter will become wide, which is going to give barrel chest, which is going to show the barrel chest. In this lateral infrasternal angle, lateral compression over thoracic cage and the obliques pushing the lower ribs together, anterior posterior expansion of the thoracic and abdominal cavity will be more. Tightness into the abdominal muscle, decreased belly breathing. That will be belly breathing will be increased in this case. Okay. Anterior posterior diameter of the thoracic and pelvic diaphragm will increase, which significantly create pelvic descent, tightness of hip and shoulder internal rotation, adduction and extension, more stretching of pubococcygeal muscle. Okay, so this is what is the, again, effect onto the whole core. So please take a screenshot, and we can, if you have done the pelvic floor workshop with me, you know the muscle orientation, from where they are coming. We have a 15 paired muscle. What can be the effect over the pelvic floor muscles? You can always correlate. and how pelvic floor muscles are related to the back. So this is also very important. Not only that, this ascending and descending on downward and upward side, there can be, assume that your patient is having a spinal, like for example, scoliosis patient is there, or any case where you have one side of misalignment into the right and left body. So one side of the body is tight and one side of the body is kind of weak. So in this case, you might see that ribs are, they are not on the same level. So one can be up, ascending up, one can be descending down. This way, they can alter the whole body mechanism. Okay, the one side of the whole, this side can be tight, this side can become loose. So it is not one side will be like only anterior posterior diameter will be increased and decreased. It can be even the right and left body can also affect. So do check infrasternal angle. Is it right, or is it high, or is it less, or what is the status of the position of the shoulder alignment, rib alignment, ASIS alignment? That is going to again affect the whole body biomechanics, isn't it? So this is a second thing which I will recommend all of you, that do assess that also, and that can help you in understand that it is not always that we have to give, in the case we have to put a person in a strengthening program, or we have to put a person in a relaxation program. No, it can be one side of the body which requires that relaxation, other side of the body requires strengthening. So we should always look at the body as a left and right also. It's not the, kind of as a whole. So yes, please take care of that and do assess that. Okay. And this is what, please take a screenshot. Again, I have explained. In case of wide infrasternal angle, there will be good normal movement of the shoulder, internal rotation, adduction and extension, limited external rotation, abduction and flexion. In case of narrow infrasternal angle, yes, there will be normal movement of shoulder, external and rotation, abduction and flexion, and limited internal rotation, adduction and extension. Yes, you will understand that more when you will look at your patient. Okay, check their shoulder movement and check their lower body hip movement also. You will find difference. So that will give you more clarity, and you can give better result, because your assessment will be more kind of significant assessment, and you can help your patient not like as a whole body. You will be able to give your approach right and left, and then even ascending and descending. That the whole core you can be able to assess and help your patient with. All right, and we now let's understand not only the diaphragm, and it is very important. The upper diaphragm, abdominal diaphragm means that the dome shape, but also very important to understand the abdominal muscles. Yes, some of understanding we get how they're attached with the ribs, and if the ribs will be flared up and they will be tight, how it will create attention into that. So we all are thorough with our anatomy about our, that was a part of our curriculum. But just for a kind of very quick revision, we know that we have some muscles present here, abdominal muscles. And these abdominal muscles are anterior abdominal muscles, lateral abdominal muscles, posterior abdominal muscles. Some anterior part is there, lateral part is there, posterior part is there. So we all know that. More specifically, when we say that the layer is kind of these are the very strong muscles. And God has given us this wide span muscle uh, for a kind of, for a reason actually, because assume that just try to recall that time when we were on our four limbs like animals. Now all the animals, when they are on their four limbs, so the one muscle which should be very strong in their body is a abdominal muscle, because abdominal muscle is the muscle which has to continuously work against the gravity, isn't it? Because they are on their four, all the animals. So they have the strong kind of, very good muscles present there. And the fibers are so good as well. And they are slow twitch muscle fibers. Mostly they are slow twitch muscle fibers, which is responsible for creating the endurance most of the time. So that is how the God has given us this big span of the muscle anteriorly, and all animals are having it. And we were also on our four in our ancient times. But due to the evolution, we came like this. So when we came like this muscle is not longer work against the gravity, but still we have a strong muscles present here. And into this, now when we, due to the revolution, when we go like that, now which muscle has to now work against the gravity? That load goes to the pelvic floor. Now, pelvic floor has to work all the time against the gravity. Otherwise, God has created this muscle to work against the gravity, which is a kind of very strong abdominal muscles. And these muscle fibers are, again, every muscle of our body, when we talk about the skeletal muscle, they have the orientation of the fibers. Muscles are going as per the origin to insertion. They might have fibers longitudinal, they might have fibers transverse, they might have fibers obliques, they might have fibers circular in two directions. So direction of the fibers are going to give us that clarity, whenever we are like kind of treating our patients and assume that patient is having some trigger point, some kind of tensions. So we can work according to the direction of the fibers. Okay, so we have a direction of the fibers to sustain the load as per the requirement. So this way, these are the four muscles, which is very important in our abdominal area. We all are aware about that. The first is you can say the rectus abdominis, which is very central muscle, kind of abs. We are calling it the 6 abs and 8 abs. So this is the rectus abdominis muscle, central muscle, which is coming from the xiphoid, same xiphoid on the up, where the dome is also attached on the top. So dome is also attached, and downward this rectus abdominis is also going downwards. And from that xiphoid process, it is going all the way spanned to, and they are attached to the pubic symphysis, inferior angle of the pubic bone. They are attached there. So it's kind of which fibers will be present? They will be longitudinal fibers, or like this, upper to downward. So longitudinal fibers, and these fibers are, again, they have a facial sheath present, because we don't want a very continuation of the muscle, because it's a long span. So every point, we have kind of three kind of facial sheath present. So kind of three divisions are present into this divisions, which divide this muscle into four segments. So this is what is the facial and connective tissue, which is covering the whole muscle and giving it a division also. So the load can be, transformed. So assume that if the person is flexing the trunk, so load can be taken care by only on the upper part of this muscle fibers, where my cursor is moving. So this is my cursor over here. If person is doing the flexion from the upper part, so when I'm doing that abs workout or flexing my trunk, so these muscles can only, upper abs can only kind of come for the contractions. So if you are doing the flexion of your limb, your lower leg, so these muscles can start getting affected. So every time the load can be shifted to the different part. And if you are tucking your belly button, so the movement can happen here in the central area. So when we are talking about the central area movement around the umbilical, and we are always guiding our patient also, tuck in your belly button. So when you're tucking something from the center, you are working, activating the all fibers. So sometimes we can activate upper body, upper abs also. Sometimes we can activate the lower abs also. Sometimes we can activate the lateral, this oblique abs also. And sometimes we can activate the whole abs. So in which case we can activate the complete abdominal, when we are asking the patient to create a to tuck in the belly button. So tucking the belly button means activating the all muscle fibers, but only flexing the trunk is activating the upper abs or that abs fibers. Doing the flexion of the lower body is a lower ab workout. Sometimes you might have heard about upper ab workout, lower ab workout. Okay, so this is kind of arrangements are present in our body, which can give you kind of specific effect, specific result on that specific muscle where you are working on. Okay, so very important. So this is the rectus abdominis, and this is why you might have seen into the gyms, upper body workout, lower body workout. So that kind of things are going on. Okay, so this is the rectus abdominis muscle, very, very important. And this muscle is again right side, which has the right side muscle, which has the divisions. So you can do upper, lower, and the middle ab workout, or it can be, it is also right and left. So right and left muscles are there, and the right and left muscles, they are all they are coming from the xiphoid and going to the into the center towards the pubic symphysis, but there is a central aponeurosis. Their connective tissues are joined together into that one central sheath. And this central sheath, which is the joining part of this, we are calling it as a aponeurosis. And this aponeurosis, this connective tissue, in our language, we are also calling it as a linea alba. So this is a one part of the linea alba, very kind of very superficial, or into the area, into the center actually, not superficial, into the center, where this right and left side of the muscles are going to come and fuse together. So this connective tissue is very strong. It's not only the rectus abdominis muscle which is attached here, even all the muscles which is present into abdominal area, they are all attaching into the center. So we know that we have external obliques. So external obliques are coming like this, isn't it? And these external obliques fibers are like your pocket, or you're putting your hands into your pocket. So fibers are downward fibers coming from the ribs, going all the way from the sides and into your pubic, this ilium also. So they are the downward fibers going on like that. Okay. So these downward fibers, which is right and left, they are also having the same aponeurosis, and they again fuse into the center. So aponeurosis or linea alba is not only the sheath of rectus abdominis, it is also a sheath of external obliques. It is also sheath of internal obliques, which is also coming. They're also coming from the sides. Their aponeurosis will also fuse with each other. So you can understand how strong will be this linea alba. It is not only one connective tissue. It is a kind of fusion of all these muscles which is present into the abdominal area. It can be that rectus abdominis, external obliques, internal obliques, as well as the transverse abdominal muscles, which is very important. So all these muscles, transverse abdominal is a very deeper muscle, kind of deep, and their fibers are kind of again obliques. They are coming in the circular motion, oblique fibers, and they are more deep. So you can understand that transverse muscles are the more deepest muscle which is going to come very close to the organs. So we have abdominal organs going on inside. So when assume that pregnant female, when uterus is getting expanding, uterus is putting pressure because uterus needs space, the first pressure uterus is going to put against the transverse abdominis muscle. So that will start getting stretched out. Okay, that much of the deeper muscle is present, and that also has aponeurosis. So that also has this kind of fusion. So you can understand the linea alba is a fusion between the aponeurosis coming from the transverse abdominis, internal oblique, external oblique, all the way, and rectus abdominis into the central area. They all are fused in the central line. So you can understand all these muscles are somewhere coming from that thoracic cage. They are attached, this ribs and intercostal space is there. So when we have internal extensions going on, so they can stretch out, muscles can stretch out into out. When they are stretching out, the aponeurosis start descend, they might start separating from each other. So all the muscles aponeurosis can start getting stretched out. And that can lead to separation of the connective tissue, which is into the center, linea alba. So now we understand the correlation. If we have a high, very kind of wide infrasternal angle, so now you can understand diastasis recti can be present or more separation. I'm not saying that diastasis recti can be weaker tone. So any area might be there's no separation, or the finger, one finger, two finger separation is not present, but might be weak tone is present. So what is the good muscles? The central tone should be good. But the central tone, upper part, lower, middle part, and the lower part, everywhere central tone should be good. So we have to assess the central tone of every point. And if the tone is weak somewhere, assume that tone is weak at the upper side. So we need to facilitate this upper fibers by giving upper abs workout to the person. If the lower tone is weak, so we have to facilitate this lower tone by giving the activation, or by facilitating the movement there, like lower abs we can give, or by doing the activity of the lower limb. And the same way that trunk rotation side to side. So if you found that obliques are also important, so the tone is not there, so we might have to give the trunk rotations activities to the person as well. So, and even the planks, side planks. So, because whenever the person is into the side planks, you can understand how strongly, how beautifully we can work onto that obliques of the person, isn't it? Including the transverse abdominis. So, side plank is a very good activity, very good exercise where external, internal obliques as well as the transverse abdominis muscles can be activated. And these side planks can bring the rib cage also closer to each other. So side plank is a good activity to give to the person who has a rib flare, who has an infrasternal angle, wide infrasternal angle. It is very good for the person who has a diastasis recti. But this is not good exercise for the person who has a weak, tight infrasternal angle, less than 90 degree. In this case, we should not give side planks. It means activation of the whole side areas. Okay, so this is very important to understand that this is the core and how this core can affect our that can be affected by this infrasternal angle or your abdomen. Not only that, you can also understand that these muscles are attached, they are coming from the back. If the back muscles are tight and if they are weak, how they can affect these muscles? They will be more strained, they will be more tight. So we will also discuss about that in upcoming slide. So yes, this was a kind of small introduction. But if you want to learn more about that, even the diastasis recti, so there are so many programs and workshops and webinars going on. You can always go for that. We have say not only the abdominal and lateral muscle, the anterior anterolateral muscles, we also know that we have a posterior abdominal muscles present. Like we have a psoas major, minor, iliacus, quadratus lumborum, even the diaphragm, which is also present on the top. So they help all in respiration, trunk movement, hip movements. They are helping us in creating the stability, providing the stability to the spine, postural stability, protection to our internal organs. They are facilitating the movements, everything. So very important, these back muscles are also there. So you can understand that if we have muscles which is going on from the side, we have this lateral muscles which is going on, transverse muscle, which is going on from the multifidus. If this back is, so what happens during the pregnancy? So during the pregnancy, when there's a loading going on from inside out, when uterus is expanding, that is putting stretch over that transverse abdominis, internal obliques, external obliques. So kind of stretching is going on anteriorly. So when this anterior stretching is going on, the muscle will start creating a tension, more weakness anteriorly, and laterally the muscles will start getting weak and they will pull, they will create a kind of shift to the pubic bone. So we have this whole ilium, and so you can understand that ASIS. So in this case, patient might be showing you anterior pelvic tilt. And due to anterior pelvic tilt and due to this anterior laxity into the muscles, the posterior lumbar area will start pulled anterior. So that can create a tension to the back muscles because you have more weakness, more loading going on anteriorly. So more lumbar kind of lordosis will be there, more anterior straining will be there because pulled is anterior all the time as per the center of gravity shift also. So that can give, and uterus is also expanding. The reason is uterus is expanding anteriorly because uterus fibers are highly elastic in anterior and superior layers. So always uterus will expand anterior more, lateral, anterior and superior more. So due to that, the loading will be anteriorly more, anterior pelvic tilt, and more weakness into anterior muscles, obliques, as well as that straining and tension around the lumbar muscles. Then the lumbar lordosis will happen. That same thing happen in case of obesity. Whenever person is obese, the same thing can happen here. Whenever person has a diastasis recti, you can also understand the diastasis recti, the person will be present with the low back pain. Muscle lordosis will be present in these cases because you have anterior expansion. So that is going to pull the spine anteriorly. Okay, so there will be, and because of the center of gravity shift. So that can create a spine issues. Person can start showing you all the time hyperlordosis, hyperkyphosis around the spine. So yes, this is the correlation of abdominal muscles with the back muscles, the whole spinal area. So this is the correlation. Not only that, the pelvic floor. So most of you are trained into pelvic floor. You have understanding, you have experience from your patients, you are dealing with the patients also. So you know that how these muscles are kind of crucial part, and they are supporting our pelvic organs. They are right and left. There are three organs present in a female body: bladder, uterus, and anus, and their canals are passing through the pelvic floor. So muscles are supporting the organs. Organs are resting on the muscles. They are supporting the organs. Even the canals of these organs, they are like urethra, vagina, anus. They are also passing through these muscles. So we have some openings present. We call it as a hiatus. And around this opening, the muscle is looped around this whole organs to maintaining that continence in cases, or maintaining the contractions in cases. So we don't want this urine to go out and leak all the time. So muscles are looped around that urethra, and they are working as an external urethral sphincter. These are the pelvic floor muscles. Same muscles are looped around the anus, and they are calling it as an external anal sphincteric muscle. Muscles are also loop around that, not completely loop around, but they are kind of creating a looping around vagina also, like pubo-vaginalis muscle. So these muscles are very important muscles, which is helping in creating a closing, maintaining the tone around the area. And so the content should not fall out. Even the gravity, center of gravity should not pull the organs downward. So the organs, urine should not go out. So external sphincteric muscles will work good. Urethral sphincteric muscles will work good. External sphincteric muscles around that anus will work good to maintain the fecal continence. Same way to create a good contraction around the vagina. So, because vagina has so many organs present. Yeah, in correlated to the vagina, we have from the vagina we can see we have a cervix, which is a part of uterus. We have bladder, we can palpate bladder, we can palpate urethra, we can palpate rectum. So these organs are somewhere all related to the vagina, which is a central part. So this vagina should not start falling down, and gravity should not put a descending pressure. So muscles are present. Pelvic floor muscles are present around the vagina, which is helping in creating a looping around the vagina, compress the vagina towards the pubic symphysis. And these muscles are pubo-vaginalis muscle, which create an angle, closing effect around the vagina. So the organ should not start descending down, and the ligament should not start getting weaker. There should not be prolapse around coming from the vagina. So we don't want all these things. So pelvic floor muscles are very, very important muscles, which is helping in maintaining urinary incontinence, the prolapse, as well as the anal continence. But if these muscles will become over tight, so they will be very tight muscles. You can understand tight muscles. They will compress all these openings. When the openings will be compressed, they will apply ascending pressure. So in this case, the pressure is not coming from the up. Now let's understand that the bottom part here. So we already understood this diaphragm. Now let's understand this one. If these muscles are tight, over tight, so when they are spasmodic, hypertoned muscles, they will apply ascending pressure. Due to the ascending pressure, pelvic content will not be able to relax completely. There will be always someone is squeezing me from the bottom. So the fascia can be tight, and fascia, this is a levator ani muscle, more deeper. So if this levator ani muscle fascia is tight, that can create a tension around that organs which is situated onto that. If this floor is tight where I'm sitting, so there will be tension which I will feel as an organ. So organs will start getting tensed. Not only the organs, their structures, the blood supply which is going on, their lymphatic system, the draining, the arteries, their nerves, they might start getting compressed. You can understand when they will start getting compressed, their blood circulation to that organ will be restricted. If the blood circulation will be restricted, there will be less oxygen going on to the organs, and might be organs will show you some kind of tension. They will not work optimally. Assume that we have ovaries present into the area, which is our primary organs. Due to this tension, there might be the arteries which is supplying the ovaries. They are not, sending good amount of blood there. So the ovaries will not get good vascularity. So they will not develop good eggs. So eggs quality can be affected because they're not getting good blood circulation, and even the lymphatic system will be also trapped. So the organs can start getting, they will be stuck. So ovaries will start getting stuck. Their system, which is supplying that area, they might also start getting stuck. Not only the ovary, even you can understand that uterus. So uterus, which should expand every month, we have this menstrual cycle going on, menstruation, endometrial sheath is going on. Why endometrial sheath is developing? Due to the good hormones, due to good vascularity to that area. But assume that vascularity or lymphatic system is hampered. The toxins are not going back, and there's some kind of tension is present on that area. So the organs will not work optimally, isn't it? Their blood supply, everything will be restricted. Same thing can happen around the rectum. So that might also affect. So it might be congested area, and this is what we can we can term it as a pelvic kind of syndrome, or pelvic pain syndrome, or pelvic congestion syndrome. Something into the pelvic area is congested. So that can be the reason. The one reason can be the tight pelvic floor, ascending pressure, upward pressure. So in this case, the organs are not able to relax. The structure which is associated with the organs are not able to relax. So that is, the organs will not, that might lead to PCOD, menstrual irregularities, infertility, tight pelvic floor, which can lead to vaginismus, dyspareunia, sexual pain, pelvic pain, defecation issues, urination issues. So many things can happen due to this congestion, tightness, and ascending pressure. And these pelvic organs will always, under this effect of ascending pressure, they will put pressure over who is present over the pelvic organ, intestines. So our intestines will also get under this effect, ascending pressure. If that pressure is there, you can understand large intestine. That can also get a ascending pressure. On the top of large intestine, spleens, pancreas, our liver, even this kind of organs, they will be always under the ascending pressure. Our dome, abdominal dome will be also under the ascending pressure. The thoracic cage, so everything is upward pressure is there. No relaxation. Person will be stuck. Something is stuck inside. So not complete 100% relaxation into the body. Pelvic congestion, abdominal congestion, thoracic congestion, and exhalation is not able to kind of exhale completely. So always is kind of stuck. Person will be stuck. So this kind of posture will be there. So tight pelvic floor can create a upward tension. So yes, and the muscles can be tight. Superficial transverse perineae, deep transverse perineae, all the transverse muscles will start getting tight and compressed. So, and creating the ascending pressure. And if these muscles are tight and compressed, you can understand that if you cannot expand, so your durameter, understand your durameter. So your your durameter, anterior durameter will be kind of, again, it will not relax. So that will give you spine pain also, pain around your back region, your thoracic area, lumbar region, everywhere, sacral region, everything will be tense and tight. So tension can be there when your muscles are tight, pelvic floor. In other case, and in this case, when the muscles are tight, these angles, we are calling it the pubic arch angle, which is present here. It will be tensed like this. So tight pubic arch angle will be present here, less than 90 degree. We know that this pubic arch angle is approximately 90 degree in female and 70 degree in male. There will be more tension and tightness because upward pressure is going on. And when upward pressure is going on upside, so this lateral diameter will increase. Obliques will become weak. So yes, that can definitely show you different tension and tightness. Iliopsoas will become tight, piriformis will become tight. So no, that can show you some tension into some muscles, some weakness into some structures, and this will be like that, upside pressure. And this internal inlet, it will become open. So opening of internal outlet and closing of external outlet. So because ascending pressure is moved. So this can be that one thing which is due to the tension into the pelvic floor muscles, and hypertoned pelvic floor can definitely affect the whole body. So when we are treating our patient for tight pelvic floor, it should not be only pelvic floor. It should be the whole body approach. So do perineal assessment, treat those muscles, and also take care of the whole body of the person as well. Okay, ascending pressure, you have to try to relax from upside. So in this case, one important thing which we can add is that better inhalation. We can tell our patient to keep inhaling, deep inhalation. So more inhalation, more air, try to fill it so that can help into descending the pressure, which is upside. That can help in relaxing the pelvic floor also by creating this descending pressure. So you can take a help from breathing when your muscles are tight. Okay, and same way, if your muscles are, assume the weak muscles are so weak around the pelvic floor muscles, they don't have a strength, they are hypotone. When they are hypotone, the good muscles are creating a good alignment of your pelvic bone. So they are the muscles of stability. So this is a muscle which is present here, and these muscles are attached, and this is a superficial transverse and deep transverse. They are coming from the ischial tuberosity, and they are going into the central perineal body here. So assume that these muscles are not strong, they are loose and weak muscle. These muscles are loose and weak. When they are loose and weak, so they will not bring the they will not maintain the stability of ischial tuberosity. They will fail to maintain their positioning. In this case, the ischial tuberosity will start going away from each other because the muscles are kind of weak. In this case, this diameter, you can understand, if the muscles are, ischial tuberosities are, the muscles are weak, they will descend out from each other. So what will happen to the pubic arch angle? The pubic arch angle will become wide. Okay. Patient might show you some pain over the inferior part over here, the pubic symphysis, painful pubic symphysis. And descending, this is a kind of open. So open outlet and tight inlet. So when the tight inlet, again, the pressure from the sides will be increased. In this case, the lateral diameter will be narrow and anterior posterior diameter will be wide. So this can happen into the abdomen and this can happen to the pelvic floor. The lateral diameter is wide. Okay, so when they are wide, lateral diameter, so you can understand that it can definitely going to decrease. These muscles will go like that. So organs will start getting descending. So pelvic floor muscles, because they are weak, so they can affect the organs. Organs will start, gravity will start pulling the organs downward. The descent of the organ, pelvic organ prolapse. And when the muscles are going on the side, they will not loop around the organs also, the canals. So they will not, they start getting weaker. They might not hold the urine. They might fail to hold that anus, the urine incontinence, fecal incontinence. When they will fail to hold, create a pressure. So the pressure will not be also fall over the vena cava, our venous system. We have the veins present into the perineal region. So you can say the scrotum, into the scrotum, we have the veins. So patient can, go with, they might present with the varicocele. If she's a female patient or even the male patient also, we have veins present, like all these veins, which is into that anal region.